Hello, everyone. Welcome to this meeting. We will start the meeting with a few words of felicitation by our leader of GICS, Dr. Professor Tamina Banu. I hand over this few minutes to Prof to say a few words of felicitation. Over to you, Professor Tamina.
Hello, everyone. It's good evening from Bangladesh. Greetings from Global Initiative for Children's Surgery. And I'm so happy that our nursing group has organized this timely topic webinar. I'm sure all the participants will benefit from this. I won't take much time. I look forward to a successful webinar, and also I'll request Vinita, Gunmi, and others to have a publication out of this webinar. Thank you very much. Thank you.
Thank you, Dr. Tamina, for coming here and saying those words. It means a lot to us, you being present and supporting us. Thank you for the few minutes. Now it's my pleasure to be here at this webinar, the nursing webinar. As you all know, Global Initiative for Children's Surgery includes a team of health professionals committed to improving surgical care for children. As pediatric nurses, we stay at the forefront of care, being present near our children all the time, and therefore our roles become multifold in the healthcare scenario. The cost of our care is in many instances unaccounted for, but yet most often those are the ones that forms the essence of care. The unsaid, unaccounted care aspects are the core that brings better outcomes for our patients in any setting. COVID has brought nursing to the forefront, and we have to make use of this opportunity to continue to share the important role that we play in bringing better outcomes for our patients. This discussion today in our webinar is a glimpse of what nursing is like in different countries and how nursing is recognized in each of those countries and what they do as nurses or what the country does for the nurses. The speakers also will be sharing the impact that pediatric surgical nurses can bring on patient outcomes. May not be a detailed presentation today. We'll just have a glimpse of these aspects today, and we hope that we can continue to talk on these matters in our meetings that we conduct very often. I thank all the speakers for accepting to share their points, and thank and invite Comrade Olubunmi to moderate the session today. And before we start the session, I would like to introduce and say a few words about Bunmi. Comrade Lal Ayuddin Olubunmi is a compassionate pediatric nurse leader who is committed to advocacy, policy, leadership, and strengthening the health system. Olubunmi served as the immediate past president of the National Association of Nigeria Pediatric Nurses. She was also the immediate past chair of the Global Initiative for Children's Surgery Nursing Working Group, and was the board member of GICS. Olubunmi is the co-facilitator now of the Global Nursing Leadership Institute for Africa region, endorsed by the International Council of Nursing. She is the CEO of the March Healthcare Initiative. She currently also serves as a technical advisor for WHO Integrated Clinical Care. She has played a significant role in ensuring nursing and integration of nursing into Nigeria's surgical plan, the first of its kind in the world, the National Surgical Obstetric Anesthesia and Nursing Plan. And she was also instrumental in the development of Nigeria's strategic direction for nursing and midwifery. Olubunmi is a compassionate leader. We are indeed glad to have her here in this webinar as the moderator of the session on economic power of nursing care, country perspectives for healthy future. I now hand over the session to Olubunmi to lead the speakers in their different talks. Over to you, Bunmi.
Thank you very much, Professor Venita. Once again, good evening, good afternoon, good morning, wherever you are joining us from. This is Global Initiative for Children's Surgery, GICS, and we are saying thank you for joining this webinar. It's going to be an interesting section. I know that when it comes to nursing, we actually do not talk about economics contribution and economic strength of our care. But trust me, you just sit down. The meal is quite well prepared and delicious, I can assure you, and you're going to enjoy it. And on that note, I want to start quickly to say that we have amazing team of leaders who will take us through this section. Permit me, please, to quickly share my slide just for you to also have, 1 minute. Okay, just for us to have idea of who, at least put a face to our presenters. The first presenter we're going to have is Mrs. Evelyn. Evelyn serves as the Secretary General to the Trained Nurses Association of India. She has served in different capacity. However, we don't have Evelyn joining us right now, but we have a presentation. So what I will do now, I will pause so that we'll have a presentation first. And on that note, I want to call on Professor Marilyn, who is one of GICS leadership. So please share with us Evelyn's presentation. Prof. Marilyn, if you don't mind, please go ahead.
Okay, you'll have to unshare you have to stop sharing yours and then I can, okay, perfect.
Yes.
All right.
Delegates and participants. Good morning to each one of you. I bring greetings from the Trained Nurses Association of India. It is my honor and privilege for me to participate in this global webinar on behalf of the TNAI. Especially, I take this opportunity to thank Professor Dr. Vinitha Ravindran, Dean College of Nursing, for giving this opportunity to speak on how does India invest in nurses and nursing. As you all know that India is a rich and evolving healthcare landscape. With its vast population and diverse healthcare challenges, India has long been a leader in shaping innovative nursing practice outcome worldwide. India's investment in nurses focus on several key areas to strengthen the healthcare workforce and to improve the quality of healthcare services. These investments are critical given the country's large population and growing demand for healthcare services. Let me bring to your attention as to how India invests in nurses and nursing. Number one is education and training. As you all know that India has established a large number of nursing institutions. Currently, we have more than 3,000 nursing institutions are there in public and private areas. This helps to increase the number of qualified nurses. Further, government has taken some more initiative in 2023 to initiate more, almost 137 nursing institutions in government attached medical colleges so that they can give increase the number of qualified nurses. Again, they are also government is focusing on skill development programs. Through initiatives like the Skill India Mission, nurses undergo specialized training programs to improve their skills such as critical care, geriatric care, and other specialized areas. Further, they are also giving more importance to the skill development and faculty training so that the nursing training will be provided by the qualified teachers especially for the quality education. Again, they are also government also providing financial assistance and scholarship for the students as well as so providing loan facilities for the students, those who are unable to meet their expenses. Government again focuses on the nursing cadre expansion. As per under the National Health Policy 2017, the government aims to expand the nursing workforce, increase training capacities, and raise the nurse to population ratio to meet the international benchmarks. Further, they are also given much more concentration on Ayushman Bharat and Community Health Officers course as the frontline workers in the health and wellness center to deliver primary healthcare and preventive services. As you all know that in India, 70% of the populations are living in this rural area, and government has taken the initiative for this initiative to this program. Now, also focusing on independent nurse practitioner program, also is now we coming to actively it's coming up, and there's on the Indian Nursing Council developed the very varieties of nursing independent nurse practitioner program for various specialties. Now in future, definitely this will coming up in every area of nursing. Again, they are focusing on, because as I said before, India is a vast country. This public-private partnership is very much essential, and because government alone cannot meet this all the growing growing population, and they are also investing more on public-private partnership to accelerate the development of nursing institution. Even in India, nearly 15% is the public institutions, and almost 70 to 80% are managed by the private sector. And again, another one is the National Accreditation Board for Hospitals. Mainly, they are concentrating on how to improve the healthcare delivery, how to promote the patient safety, and also helping them how to enhancing the healthcare systems in India. And they are mainly concentrating on how to promote the professional development as well as streamlining the hospital operations. India is a so many sectors are there, and mainly they are giving concentration on the whether the NABH board is giving validity to all, taking care of this all the areas. Now we'll see concentrate on role of professional nurses in professional development. Because this is the one TNAI, the Trained Nurses Association of India, is one of the oldest association in the world. And this is the biggest association also. And they have several objectives. But one of the few of the main objective is to promote the high standards of healthcare and nursing practice. And to promote the welfare of the nurses is the major objective of this association. Because it across India and abroad. There are, in spite of all this continuous professional development of various activities, various welfare programs, still we too face some of the challenges also we are facing in India. Mainly about investing in nurses, well, is crucial for improving healthcare system, comes with a variety of challenges. Some of the challenges include funding constraints, because India is a vast country, huge population, and lot of required needs are there, and so again the budget is very limited, and due to this the nurses are getting the very low salaries, and this is happening in private nurses. Private institution are getting that means low salaries, and this lead to the job dissatisfaction and high turnover rates, especially when private sector are overseas opportunities are not more lucrative than nurses just to be there in India for as soon as completed the nursing. They'll here for only few months. They learn all the techniques. And as you all know that Indian nurses are very intellectual and they can adjust it to every situations, and they find this opportunity to go abroad. Now again, all the overseas opportunities are free of cost, and the turnover is very high in India now. The nursing shortage, because of this, all the that means overseas recruitment and so many things are available. Now the high demand and low supply. Even though as I said before, there are nearly 3,000 to more than 3,000 nursing institutions are there, more than 300,000 nurses are passing out every year, but still we find it that these nurses are not adequate. And there is a growing demand for healthcare services globally. Indian nurses also are willing to go all over the world. But the number of trained nurses are still, we find it insufficient. This is exacerbated by aging population and an increase in chronic diseases, and like other global, wherever you see, the same thing is happening in India also. And again, as I said already before, immigration is one of the, that means a key point. Nurses from lower income countries often migrate to wealthier nation for better pay, better condition, and better self-esteem, and so many other features are available. Those are going over there, and this also creating a shortage in the home country, in our country. And again, the lot of workplace challenges also is there. Burnout and stress. We all know that we as nurses, we know we have to put up the long hours, understaffing, and difficult working conditions to lead to burnout. This negatively impacts the nurses' retention and discourages new entrants into the profession. So it's very, as globally, this also is a problem. Then we too, India also facing this. Lack of support and career development. Nurses often face limited opportunities for professional growth, leadership roles, and continuing education, which can lead to stagnation and reduced job satisfaction. Because many times only few nurses are getting this opportunity, and not the entire nurses is very difficult. And educational barriers are also there. Access to quality education, because mushroom of colleges of nursing and institution, then some of the institutions, really quality of education also is compromised and outdated, because now curriculum, because even trying the level best to make the review the curriculum, review the standards and everything, but still the growing, the technology and all the other things really making us taking it forward, and it's very, sometimes it's also facing some of the problems of the outdated curriculum. Lack of representation decision making. Nurses are often underrepresented in health policy decision, which limits their ability to advocate for better working conditions and professional development opportunity. This is of the, also we are, this as other places, the same thing in India also. We have this many times the nurses are not involved in the policy decisions, and mainly is a hierarchy and taking care of the medical professions, yet we are also struggling in this opportunity. And again, public perception and value of nursing, undervalued profession, but still nowadays is evolving, and lot of changes is to keep taking place. But in many society, nursing is not viewed as a prestigious or valued profession compared to other healthcare roles. This can lead to reduce the social support or for investing in nurses and other well-being. Still, in India also we are facing this problem. Nurses are looked upon little lower than all other professions. And gender bias. Nursing is traditionally seen as a female-dominated profession, and gender biases may contribute to the under-evaluation of the role and under-investment in resources for nurses. But still, we are coming up little by little more. But this, but still, it is there. There are a few more also is there, but still, as these are the major challenges. But yet, the professional, as a professional association, we are trying our level best to meet all the challenges by providing the holistic approach, and we are trying to improve the. That means we are requesting the government also funding, policy changes, and all the addresses. But still long way to go. We have come up so much, but we need to go. So we are requesting the government and other parties invest in the critical role of nurses, play a critical that means so that they can, we as a nurses can provide the better healthcare facilities.
Wow, amazing, amazing. I think that is quite informative. That presentation was actually by Mrs. Evelyn Kanal from India. And I'm sure, distinguished listener, a participant, you listen keenly what she said about challenges. I know she touched base. She touched base on different modalities and then strategies and approach in India to support and promote nursing. And she talked about different cadre of expansion, national health policy, and of course the association. And she mentioned numerous challenges. But one of the challenges that really struck me and is universal is the lack of representation of nurses in decision making. And I really want us to resonate with this. India, we know the population, how many billion of people is vast. And if they have this misrepresentation of nurses, which means that it is something that we need to look at our national level and global level. And this is really a call to action for each and every one of us on this panel today. How do we do that? We all have some of our country that do not have a department of nursing. That is a big challenge that needs to be addressed. Thank you, distinguished colleagues and friends. And right now we are moving to have Professor Ayat's presentation. Let me just Professor Ayat, can you put on your video, please? Okay, I wanted to share my slide, but go ahead. Distinguished colleagues, I just want to say that Professor Ayat is a mentor, he's a friend, he's a leader par excellence. Professor Ayat is a full professor at the Ahmadu Bello University in Nigeria. And of course, we know that Professor Ayat is an Egyptian by native, but trust me, she has spent a long time in Nigeria. She has contributed to the advancement of nursing in Nigeria, nursing education, service delivery, and of course, curriculum formulation. Please join me to welcome Professor Ayat. Professor Ayat, over to you, please.
Thank you, Olubimi. Thank you so much, Prof. Venetia, Lydia, Ame, and all Catherine, and all of you. And I'm so happy that I'm contributing in this this nursing day. It is late, but at least we are doing it. And I'm so happy that I'm a member of this GICS, and I'm happy just to contribute. And I'm not Egyptian or not Nigerian. I'm African nurse. And Africa, all of country, it is the same. So we'll speak about today, speak about the economic power of nursing care country perspective. I will speak about Nigeria. Before I will start here, I wanted to just to tell you what is the concept of power. I'm just think about that. I hope, did you see my screen? Did you see my screen, please?
Yes, Prof.
Yes, Prof. Yes, Prof.
Yes.
Yes.
Okay. Yes. Okay. So concept of power. When you speak about nursing at the power, at economic power, so I have to know exactly what is the meaning of power. So I will good use of this power. What is this and how it is acquired and how they are expressed? The confusion arises from the numerous definition of power. Some of them, they said it is a core power referred to the capacity to act or influence. Another one, they said the ability to act, influence, control, or exercise autonomy. And also they have another one is conceptualize the application of knowledge and the promote autonomy of effectiveness. And I like this is the last one with conceptualize the knowledge. When I wanted to use and invest in nursing, I have to know what is the meaning of knowledge that the nurses they have it and they are make very investment in our power in nursing. It is multifaceted and a broad concept in nursing, playing a crucial role in fulfillment, responsibility, job satisfaction, attainment to professional goal, and that also deceives the impact of accomplishment of duty. And also this is the satisfaction achievement in the professional as a goal. So it is not only nurses as I'm a nurse. No, I am a nurse. I'm a nuclear for this nursing profession. Exploring the concept of power in nursing from perspective of nurses are in the examine different dimension. I have to know this one. it will lead to deep understanding of exactly what is the knowledge effect, this is the power, and it is also make the economic effect. The care economy, it is now, I'm speaking about care. I added something here. What is the care economy here? Refer to the sector of economy activity that encompasses the provision of care and support services, particularly this related to health, education, child care, elder care, and other forms of social care. Economic power refers to the individual firm of profession, and this is very crucial when you see here, and speak about profession here. What is the meaning of profession here, and how you can use how you can use this economic power in nursing profession. The issue here it is to have valuable natural resources, and this is the country itself. What is the monopoly power? And what is the superior technology? Now we are, as a nurse profession, we have a lot of these resources that I can use it as economic. The economic power of care is also evident to innovative and deficient healthcare delivery model championed by nurses with advancement in technology and focus on patient-centered care, and this is crucial. When I speak about this is pediatric, it is patient-centered care. I'm a nurse midwife, but when I want to care, this is the woman, I have to take care of the child. When I'm community health nurse, I'm going for what is the children, what is the, I can already detect any deformities. I can also encourage for vaccination or nutrition or something like that. So it will be the working here, it will be in the primary, secondary, and the healthcare facility. Now we have to notice exactly in Nigeria, the number of nurses in Nigeria is 220,068. The nurse ratio is 1 nurse to 1,000. Oh my God, this is big gap. Only one nurse can serve 1,000 patients. The total number of midwives, it is 146,787, and the ratio here, a lot of duties it is needed, and a lot of the patients they are not received. This is maternal in child care from skilled personnel. The workforce in Nigeria, it's a 77% among all this is the health team. What is the challenges? I think it should speak structure, lack of decision making, especially after this COVID-19, when we are shocked by non-skilled nurse, shortage of number of nurse, poor working condition, increasing this burden, and with this is this is epidemic, and we are heard about this is monkeypox. Okay, that is another epidemic. Oh my God, it will be so difficult for the nurses if it were not the country is not invested in nursing. It will face a lot of challenge. Complex of the social and the physical health care. Now we have more advanced technology. If it am not invested in this technology, in these nurses, and if it am not introducing to nursing informatics, if I didn't put them as the health leader, I think we face a lot of complication again. Now, this is what is the nurses, what is the value, and what is. Why I invest in nursing? Why nursing? Not because I am a nurse, no. The community themselves, the government themselves, they know what is the value of the nurse. Nurses make up the single largest segment of the health. As I said, in Nigeria, 77% of the health team is nurses. About 23, that is 23%, it is this is physician, nutritionist, pharmacist. Oh my God. So we are covered. We have, this is one doctor, they have 3 nurses. And this is, I think this is very important. Nurses before have a valuable insight, unique abilities to contribute to the partner of health. She's improving the quality of safety care. It is also have an impact of the economical condition for both patient and the community. Now, the way that I can invest this nurse? No, the backbone at the top, the backbone of health system, worldwide nurses contribute significantly in what? In disease prevention, health promotion, Education. Nurses can prevent, managing chronic disease, promoting healthy behavior, ensuring timely health care intervention. She have a significant role in reducing the health care. How it is can? When the nurses they are meet the patient in primary health care, now they are reduce the burden for secondary health care facilities because she already detect and they can manage and they give them the needed intervention at the first level. That is the meaning, the cost for the patient going for the country, the secondary and the tertiary care facilities, it will be reduced. It will be the rest also the reduce the burden of the nurses working in the secondary and the tertiary care facilities. This fortunately in the 20th that International Nurse Day 2024 theme challenges perspective is shifting focus on the economic and how to use this nursing power as economic power. Nursing professional development, this is the only way that we have it. Nurse practitioners offer a cost-effective solution to health care by providing comprehensive holistic care. It is also the key role in expanding across health care. Nurse can help to reduce unnecessary emergency visits, as I said, reduce hospitalization. She is also saving the cost for this healthcare system. Acknowledging the importance of nurse satisfaction and the competency. And I'm just working for this satisfaction and the competency because we need highly skilled nurse. Can measurable outcome linked to the community, the country supports for the nurses profession, and also it will be play a role in economic stability of the country. What is the way Nigeria they are did here in nurses? They are prioritize the investment in nursing profession as a strengthening health system. They are invest in accredited nurse education. We can find that National University Commission and Nursing Admission Counseling Commission Council. And they did all the time. They are working together in collaboration just to ensure the accredited curriculum and the accredited and the qualified nurse. They also ensure continuous education development through mandatory continuous training. Through this is the one to increase, to renovate the license to ensure that one. Strengthen regulation support advanced in nursing practice and nurse lead care. And this is mainly what is doing here in the higher education institution when they are working and they invest on nursing at the research. We also build partnership with local, engaged national nursing association like our this is just to other nurses who are contribute here at the level and Philippines, with Tanzania, with Liberia, with Indian, with all of this we are collaborate together and make partnership. We also appointed nurses as a leader. We have many staff. They are working as a leader. We have vice chancellor as the nurse. We have commissioner as the nurse, health commissioner as the nurse. We have also this is the university governor as the nurse. We have developed also developed the finance national nursing workforce plan to ensure further service efficiency and the investing in the future of nurse leadership during this is the how we are looking for the future nursing for leader. What is the impact of this one? The economic power of care ultimately influenced workforce productivity, help reduce absenteeism, and further foster to more robust the resilient labor work. And this is very crucial when we speak about it, the impact of this. Now, what is directly impact? We can see that impact by reduce in pediatric nurse, improve the quality of care, improve the client satisfaction, improve the nurse confidence, and improve the work environment. This is if it will need really more investment, this is it will be this is the one that it will bring. And reduce what? Reduce the cost of care, reduce the hospital stay, and also reduce the nursing error and reduce this the complication. Now, what is the recommendation? This one. We need nurse education and research for more investing, and we need especially evidence-based nursing. We need nursing practice, especially also in nurse, and this is really, we need this, that all this is the nursing practice to working and to ensure that the quality of the nursing intervention is provided by nurse. We need nursing administration. In nursing administration, we need, as Obimishi said, we need more leadership by nursing. We need the nurses to be a decision maker. We need the nurses to be part of this as a policy maker. And also we need interprofessional communication. I'm emphasizing in this interprofessional communication, nurses is not, it is 77% of this health team. This is, we have to communicate effectively with whom. We have to communicate effectively with another. This is 23% of this is the health team. We have to understanding atmosphere. We have good communication between both of them. Interdisciplinary collaboration at engineering, as infrastructure, and everything, as economics and this anthropologist. We need all this one to understand exactly what is going in nursing and what is going with the patient or the this is the client in health and the sickness condition. We're removing barrier to access here. This is very, very important. As we need to improve. This is nurses to going for workshop. We have to sponsor them to going for workshop. We have to sponsor them for this to going for higher education, master and PhD. We need to sponsor them to going for this training. This is very important, and we have this advanced opportunity when they are going for this is the international level. In conclusion, I can say nurses hold this is a substantial and increasing economic power as demand for healthcare services raises. Nurses practitioners are an example of how nursing profession can provide cost-effective care. Our role as a healthcare delivery, advocacy, career advancement, and entrepreneurship enhance our economic influences and underscore the need to recognize the value and the contribution of nurses in the society, with proper investment and respect for their rights, role, and responsibility. Nursing can create even greater economic value and drive further growing for all over the world. And thank you so much.
Thank you so much, Professor Ayat, for that eloquent presentation. Amazing presentation, I must say. In fact, this is the first time I'm hearing that nurses, Nigerian nurses actually form 77% of the health workforce, because most of the time they quote the International Council of Nursing rate that says that nurses contributes 50% of the health workforce. I think, yes, I'm learning, and I'm sure our distinguished participants are also learning. Thank you, Professor Ayat. You've really itemized different ways that nurses improve economy and, of course, provide safe or quality service delivery in the healthcare sector. Thank you so much, Ma. But one thing that stood out for me is removing the barriers. How do we remove barriers? How do we get better? Because right now, not just in Nigeria, which I come from, even in other countries, nurses are being used as volunteers. They use them as volunteers and they do not pay them. They will use them to do outreaches and they do not pay them. So all of this we need to track and we need to speak out. Again, we cannot really look down on interdisciplinary collaboration. We want to collaborate. I don't know about others, but we as nurses, community want to collaborate. Thank you so much. On that note, our next presenter, who happens to be my friend and who I can describe as a real leader. I met her recently in Philippines during the GICS conference, international conference in Philippines, and she's amazing, amazing. And thank you so much, Global Initiative for Children's Surgery, for always promoting our collaboration with other colleagues around the world. Please, distinguished colleagues, I present to you Ms. Kathleen Avellano, pardon my pronunciation if I didn't get it correctly, who is the Board of Trustee, corporate secretary of World Surgical Foundation in the Philippines. Over to you, my darling friend.
Thank you so much, Bonmi. Good evening to everyone. It's night here in the Philippines. So I'm sure I hope you can hear me well.
Yes, we can hear you.
Can you see my slides now?
Yes, we can.
Let me just, okay, that's better. So I think I'm just gonna turn off my camera right now so I don't get much of the bandwidth. So anyway, thank you for that introduction, Bunmi. So I would like to share tonight. Mabuhay, kamusta po kayong lahat? I am honored to be part of this activity for the global initiatives for children's surgery focusing on the nursing group. Tonight, I'll be sharing with you the Philippines' perspective on the economic power of care. I hope I'll be able to share relevant information regarding nursing in my country. So the objectives of this presentation is to share how the Philippines invests in nurses and in nursing, as well as briefly discuss its impact on pediatric surgical nursing. I have nothing to disclose in relation to this presentation, and just a brief information on my country, the Philippines, especially to those who are not familiar. Let me share with you some basic information. We are a tropical country located in the Southeast Asia. Look out on that red circles on those maps. That's where we are. The capital is Manila, where I am currently staying. The total population in the country is a massive 119 million as of 2024. And of course, we are famous for the Filipino hospitality and our pristine beaches and islands. Important highlight relevant to our discussion tonight is that we are one of the highest supplier of nurses in the world. We are part of the low to middle income countries. And just to share common local greetings would include mabuhay, which means long live, or kamusta ka, which means how are you. So mabuhay po kayong lahat. So I am currently affiliated with the World Surgical Foundation Philippines, for which I got affiliated with the Global Initiatives for Children's Surgery. It is a non-stock, non-profit charitable foundation organized and committed to enhancing the surgical health capacity in the Philippines. Our mission is to eliminate barriers hindering Filipino indigent patients to access quality, sustainable, and equitable surgical health care. The core values of WSFP are encapsulated in the motto, care, cure, and collaborate. In the Philippines, nurses continue to be the crucial member in obtaining the country's objectives to achieve better health outcomes. We consist of both government and private sector with regards to the delivery of healthcare services. We have specialty hospitals and facilities that cater to varied needs of the Filipinos, including children needing surgical services. As of current, the country has the Philippine Children's Medical Center and the National Children's Hospital as two of the pediatric-focused facilities, while most of the hospitals, which is around 1,300 plus in the whole country, have services geared towards pediatric care. On the nursing workforce, as of recent data, we have almost 1 million registered Filipino nurses, 54% of which are active, meaning that their licenses are valid, and 33% have reported to have migrated in different parts of the world. There is around 127,000 nursing shortage in the country if we will have to consider standard nurse-patient ratio and capacity of hospitals or facilities requiring nurses. The Philippines, as I've mentioned, is known to be the largest supplier of nurses in the world. These are the countries where the need for nurses are in demand: Austria, Canada, Germany, Japan, Singapore, Saudi Arabia, and the United States of America. As of 2 years ago, there are 33% or a little more than 300,000 Filipino nurses who have left the country and is now working all over the globe. In the United States alone, 25% of nurses are known to be of Filipino descent. The landscape of Filipino nursing practice is not without challenges. Just like in any other low to middle income countries, we are faced with a significant nursing shortage, needing more than 120,000 nurses. And this demand has increased by more than double in the year 2023. There are 124 Filipino nurses who are jobless, underemployed, or are currently engaged in a non-nurse related work, like attending to their own businesses, employed in business process owners, or that we locally regard as call centers. Others may be in totally different fields. Another massive challenge that has been a problem in our country is compensation. The average salary of nurses is only 28,000 or around 500 US dollars, with public hospitals run by the government getting more than that of private run facilities. An estimated amount of around $600 for government and a mere $400 for private facilities. These disparities in local remuneration compared to overseas compensation, which is too high, is one of the main reasons why there is an increased record of nurses migrating in other countries. With the nurse staffing shortage, there is an evident increase in the nurse-patient ratio. If compared to the Philippines Department of Health recommendation of 1:12, the actual nurse-patient ratio are around 1:20 or even 50 in some government-run hospitals. With all these workload, nurses are even asked to take 12 to 16-hour shift, and extensions are not provided overtime compensation. While a lot of Filipinos, if given the chance, will choose to stay in our own beloved country, the job insecurity brought about by these short-term contracts that does not ensure regularization and much lower pay and mere health benefits opt them to find jobs somewhere else in the world. The challenges that these nurses face will contribute to exhaustion, low morale, burned out, mental health concerns, health problems, obvious decline in the quality of nursing care, and eventually, in as much as they would not want to, they would choose to resign than stay in that kind of working environment. While these may be true in some facilities, but there are a few that offers a little better job packages. So how does the Philippines invest in nurses or in nursing? The Department of Health of our government has identified an 8-point action agenda as a strategy to improve the healthcare delivery system in the country. While all these are significant for every Filipino, but the last 3 agenda are focused on healthcare workers, and number 7 specifically defines the initiatives of the Philippine government to improve the healthcare system of the country. So more than ensuring adequate number to meet the standard manpower requirement, it is part of the initiative to provide fair compensation to all nurses and that they are given opportunities to enhance their skills and knowledge in the practice of not only pediatric surgical nursing, but basically professional nursing. There's a continuous effort to keep a healthy working environment that will enable utmost performance of the job. To thoroughly discuss the initiatives that will help address the challenges, let me run through some strategies, starting off with standards in nursing practice. The Department of Health has established regulatory standards that each facility has to comply depending on the level of hospital category. A regular audit, validation, and renewal is required to ensure that compliance is maintained. While there is no official specialty organization for pediatric surgical nursing, the Perioperative Nurses Association of the Philippines has included basics in their standards of care. Our Board of Nursing, on the other hand, is now developing standards on specialty certification so that each nurse will be provided with appropriate competency. In the nursing education, there is a standard curriculum in all nursing colleges and university. Clinical experience during undergraduate exposure are given enough attention to ensure readiness of nursing students to professional practice. Subsequently, clinical educators or instructors are expected to meet the highest standards based on qualification and experience. In the current professional practice, we focus on competency by ensuring skill match during the recruitment process. A comprehensive training and orientation is provided, and regular validation of skills are performed to ensure that staff are technically updated. To address the migration and issue on retention, There's an effort to align and make salary adjustments, though this may be institutional at times, so depending on every facility. Also, human resources are looking at enhanced benefits and organizational development strategies. Another great strategy is investing in people, so much so that staff are provided with trainings, seminars, and skill enhancement programs, both for clinical and technical competency. And companies have also reinvented the focus on nurse empowerment, so much so that nurses are given opportunities to lead, manage, and develop a healthcare team. This change in the landscape has provided a lot of impact in the delivery of nursing care, thus gearing towards career pathways. And then nurses are now holding various roles to choose from and excel on. Last and one of the most important thing is to ensure that activities are geared towards work-life balance. Though all these initiatives, what could be the impact for all these investments in pediatric surgical care? Investing in pediatric surgical nursing will enable the following outcomes: qualified and certified nurses that will give assurance to patients that they are taken care of by nurses who are highly educated and trained for the job that they do, reducing or preferably eliminating errors that may translate to bigger amount of money. Competent nursing workforce who works collaboratively with the members of the healthcare team, thus providing a holistic care to every pediatric surgical patient. Reliability in nursing care ensure that pediatric surgical patients are given the treatment that is appropriate for their diagnosis, decreasing unnecessary expenses. And of course, happy and contented nurses will stay longer in their jobs and perform with utmost excellence, thus meeting the ultimate outcome that we all wanted to achieve, and that is safe and quality pediatric surgical care. With that, I would like to thank you, my fellow nurses, for your kind attention. Salamat, everyone, and mabuhay kayong lahat. Thank you.
Thank
Turning
you
over
so
to you,
much. Yes, thank you so much, my darling friend. I also
Thank you,
say,
Kate.
Thank you so
Yeah.
I also
She's
say
Kate,
salama.
Is this salam? I like you, Kate. She's very nice. I'm really
Thank you
acknowledge
very
your
much.
presentation.
So
Thank you so
I
much.
really want to say thank you on behalf of the team and of course our participants. And all the strategies that are in place in Philippines are very good, and they can also be emulated, especially when you say, and I quote, that the Filipino leadership give opportunity for nurses to lead. That is one area that is missing in the Afro region. Trust me when I say that. So I think we'll still probably come back to you and see, how did you get this happen? Does it just happen like that, or you need to advocate, or you work on it? Probably you mind to share the tips how you get to that stage. But on that note, I want to say a very big thank you. So quickly, distinguished colleagues, will move forward, and the next presenter. And like I said, we have a very good team of our leaders across the globe that are ready to support us in this discussion of nursing empowerment of care, economic empowerment of care. So right now we're going to have one of our colleagues by name Miss Amma Amisa, and Miss Amma is nurse anesthetist from Liberia. Precisely, she resides in Monrovia, the capital of Liberia. She currently serves as the Operation Smile Room Manager in Kennedy Medical Center, oversee daily surgical operations and ensure quality, safe anesthesia care. Please join me to welcome our own dear colleague all the way from Liberia. Please, Madam Amak, over to you.
Thank you so much. I appreciate all of that you gave me. I'm happy to be here. I'm from Liberia. My name is Amma, as the moderator said, I'm Ama Tapla from Liberia. I'm a nurse anesthetist. Liberia is on the west coast of Africa, a smaller country with 5.5 million people. And we have less population of nurses as the ratio of the population caring for our healthcare community. So I'll go into my presentation. Let me cut off my video. So we have the overview and current state of nursing in Liberia. As I said, Liberia has around 14,598 nurses and 6,760 midwives, providing essential healthcare across the country. However, the nurse to population ratio is 0.5 per 2,000 people, far below the WHO recommendation, 1 nurse per 2,000. We have shortage of nurses and coverage and limited access for comprehensive services. Challenges like insufficient government reclassification, limited training, and resources constraints further affect the nursing workforce motivation and the effectiveness. Nurses enhance public health by reducing mortality and keeping communities healthy, which boosts economic productivity. Their focus on preventive care lowers the need for costly medical interventions, reducing overall healthcare costs. As frontline providers, nurses play a key role in primary care, preventing severe illness and promoting long-term health. Next slide, please. So in our population, we hold like almost 50% in the healthcare as healthcare workers. We have more nurses than doctors, and most of our nurses are the ones that are on the front line. So we go to the economic impact, growth and specialization of nursing in Liberia. Investing in pediatric critical care and surgical nursing improve healthcare for vulnerable population, particularly children, leading to long-term cost savings and better public health. Specialized nurses enhance patient care by efficiently managing complex cases, easing the load on general healthcare services. This results in improving health outcomes and a more effective healthcare system. Ultimately, it helps Liberia achieve its healthcare objectives. When it comes to pediatric nursing, surgical nursing, in Liberia, we don't have a lot of trained nurses that are trained. I was opportune to be one of the few who went to Boston and was trained as a pediatric nurse and also with SMILE train. And I was also trained in various sub-regions to care for that population, because caring for pediatric, especially when it comes to surgery, you have to be very patient. And most time, our equipments we have are not friendly. They are not, children friendly. We have bigger baby cups. We have, all of our equipment. So it's difficult to really manage, children in Liberia without having all those equipments. Liberia, in partnership with World Bank and the Liberian Board of Nurses and Midwives, enhances nursing education and sending nurses abroad for specialized training to build up skills workforce. These initiatives aim to meet the country's health needs. Specialized training improves healthcare quality, boosts job satisfaction, and enhances nurses' retention, long-term in strengthening healthcare outcomes and support economic growth. So we have other partners, because our country, we suffer from war and then the COVID, and we also had the Ebola. So we are still trying to get out of those, challenges we have. So World Bank and some non-governmental organizations, they are helping in training. We send the first cohort of nurses to Kenya for training in specialized nursing, specialty, like critical nursing, pediatric critical nursing, nurse anesthetist, and the rest of it. So with that collaboration, we have sent the first, it was sent the first last year, and now we just sent in I think a month ago, we sent the second cohort of nurses to be trained. But we cannot overemphasize training when it comes to healthcare in our country. Can you go to the next slide, please? Investing in nursing training and the role of government policy. As my presenter said, most time, yes, when it comes to policy makers or decision making, yes, as nurses, we have our director of nursing at the ministry level, but you know, sometimes, yes, you are being placed there, but they don't open up to you as it relates to nurses, you know, giving the side of what you think nurses should be in your country. You know, they try to shy away things and don't listen to what, you know, our challenges are and what we need to do as it relates to education in Liberia. So in with the classification, the reclassification, you come from, you go for training out and come back, you are still being paid the same amount, you know, before you went for your training. So it's so frustrating and challenging, but yet and still, we are all opting for a better healthcare system in our country. Government reclassification of nurses is very crucial for improving performances and motivation and career advancement in Liberia healthcare system. When it comes to training, it's the same with biases, being biased or partial. You have our government at our Ministry of Health at the government level. We have our Director of Nursing who is there representing us. She's, you know, we usually come with all the hospitals, she know all of the nurses that are working and know their potential. When they come and get these training opportunities, instead of them giving that slot to the nurses to vet out, the nurses are supposed to be trained. They take it on the doctor's level and send their own people. And when they come back, they cannot fit into the system because they were never to be clinical nursing. So people who were trained up to go out for greener specials to get better, you know, salaries. So they leave, though they were trained by the government, but they leave and go to other countries for greener pastures to sustain their family. So these are things that with the bias is everywhere, and Liberia is no exception. So in nursing education and all infrastructure will enhance healthcare outcomes when it comes to the economic growth through a healthier and more productive population. As you all know, Liberia is a tier 1 country, and we are not exempted from logistic insufficiency. Our equipments, even with the infrastructures, we have some of our clinics in the urban areas that don't have anything to work with. If you go for supervisions and see the healthcare system or the facility, you cry, you know, because it will be you there, but there's nothing to work with. So instead of our government or our ministry or minister putting us on those players, the stockholders, to be a part of decision making, they push us aside and take decisions for all of us without knowing the challenges that we face. So to maximize nursing impact on economic growth, Liberia must address resources constraints, as I said, and improve healthcare infrastructures. Investing in facilities, equipments, and training are vitals for strengthening the workforce. Ongoing education and policy reforms will prepare nurses for future demands, boosting healthcare outcomes and fostering sustained economic growth. Next slide, please. So to conclude, we cannot overemphasize that, you know, most of our tier 1 countries, they don't take nurses very serious, and we do the bulk of the work. We are the frontliners. We are exposed to so many disease conditions and all of those things, but they don't take us so seriously. Even with our nurse anesthesia program, it was even the World Bank who saw the need in 2010 to give us grant to have a quick impact nurse anesthesia program for us to be specialized, because they found out that most of our nurse anesthesia providers, they were old, they couldn't see, and they had some, you know, challenges in giving a safe anesthesia. So they had to opt for a quick impact training program to educate us to be nurse anesthesia providers. So in conclusion, nurses play a crucial role for improving public health and boosting economic productivity in Liberia by reducing the healthcare costs, enhancing workforce efficiency, increasing investment in nursing education, reclassification of policy, because our policy maker only craft the policy to suit their specialty and leave the nurses out. International partners are essential to strengthening the sector. Yes, we all rely on international partners, but what can we do as Liberians and to strengthen our nurses, to educate our nurses, for better healthcare? These efforts can be positioned nursing as a key driver of Liberia's economic and social development. Thank you so much.
Wow, amazing. Thank you so much for that presentation. That's really remind me of the situation of nursing in most of our African countries. And it's so sad that government is yet to understand the importance of specialties in nursing. The specialty in nursing is the bedrock of health workforce, either we like it or not. And it's really very disappointing when we keep talking about these years and years of not inclusion of policy, where they just take decision and give to nurses to implement. And that is why you see the mortality cut across LMIC is still very high. And I really want to retrace what you said about partnership by the international partners. However, you should know that other people engage the partners before you. So they tell them so many things about nurses and they put the nurses down. So we need to speak out. We need to also strategize how to engage the international community ourselves, not looking for who we speak on our behalf. That is quite insightful presentation. Distinguished colleagues and friends, thank you so much for staying tuned with GICS Nursing webinar. Right now, we're going to have our last presentation, and trust me, it's going to be the icing of the cake. Lydia, please take the floor without wasting much of our time.
Thank you very much, Bonnie, for your humble request and humble introduction. My name is Lydia Kiptum from Kenya. I want to share my slide. Let me try.
Distinguished colleagues, while Lydia is trying to share a slide, please kindly make use of the Q&A section to contribute, ask your question, and the chat room is still open. Please discuss with us and share your own perspective when it comes to the economic power of nursing care. What is your own country perception? Over to you, Lydia.
Thank you, everyone. I hope you're seeing my slides. I'm Lydia Kiptum from Kenya. Kenya is in the East Africa. It has a population of around 57 million people, and 50% are female, 49.6% are male, 21.9 million, that is 46%, are children. Most of the population is located in urban areas, and 70% of the population is in the rural areas. In Nairobi, the capital, we have around 5.5 million people. That is around 4% of the population. In Kenya, we are the only country in the world having a national park within the city. So you're welcome to Kenya to see our national park when you visit us. So I decided to at least start by defining the economic power of nursing care. And this is the significance of the contribution that nurses make to the health population and the financial well-being of the nations. This includes the reduction of the cost. The nurses help to prevent complications and shorten the hospital stay which are major component of health costs, and they reduce the long-term health expenditures in the hospitals. That is preventive care, community health education, and even early intervention strategies. Improved patient outcome is realized when nurses are empowered, and even enhancing efficacy when they are doing their healthcare delivery. Building universal health coverage, we cannot achieve it without empowering, doing economic empowerment to the nurses as an essential builder of a universal health coverage. For us to achieve the sustainable development goals, we have to invest in the economic power of nurses, essential to achieve at least a better care of the patient. So nurses are often considered as the most trusted professional, and the trust built on having sufficient quality time to spend understanding the patient needs and even taking care of them. So ways Kenya is investing in nurses is by doing trainings and education to them, to the nurses. This has been realized by expanding the number of nursing schools. We realized that our country in 2013, it was divided into small counties, and we have 47 counties, and these 47 counties have referral hospitals, and these referral hospitals are managed by the governors who govern the small counties, like small countries, so that services can go there. And healthcare was devolved to those counties. And in this, even the training schools for the nurses and other cadres were devolved to the counties. So it means the increment of the training schools where nurses are being trained and the instructors. Financial support, there is a fund called Afya Elimu Fund, which provides loans to the nurses, to the nursing student to cover the education fee. And this loan has rapidly once increased the students who are joining the school to sustain their cycles and support. So in policy planning, the Ministry of Education, the Ministry of Health has collaborated with the Ministry of Education, Ministry of Labor to realize the market, and even they have aligned the workers in the population to the health needs in the populations. That is in the county populations. I said we are divided in 47 counties, and this has ensured the right number and mixture of healthcare workers and the training and the deployment. So job security and career effort has been made to ensure that graduate nurses are fully employed and given their pathways in their career advancement. This includes upgrading their skills and the current nursing workforce. And apart from even being employed permanently, there is a program called attachments or attachments with a pay, a step-in. So they call it internship. So they give those who have just completed the training. So challenges in investing in nurses, we have several challenges, but I picked a few, like funding and resources. There is often insufficient funds to support the education and training because we are in the third world country due to COVID issue, and the loans in the government to do some development like infrastructure has made really limited resources in the country. So there is no funding to support. Even if there is Afya Elimu Fund, it is giving to very few of them because there are so many who want to train. And this has limited the nurses who are entering the workforce, and even affecting the quality of training facilities because there are few lecturers who are being trained. Remuneration and the motivation, this has been really a problem because of the delayed salary payment and the inadequate compensation of leading to morale of nurses going down. This has resulted to frequenting of strikes, disrupting the health services, and even the nurses moving to abroad to look for green pastures. Workload and staffing has been really very high. Actually, we've not met the ratio of the WHO. That is 1:25 patients. Actually, we are in 1,000. So one nurse is handling more than 100 patients per day. And this high workload has brought a lot of burnouts and low morale, that reduced quality care, and even people not willing even to join the force, joining other careers. Policy and governance, the devolution of health services to the county government, as I said, we have 47 counties, has brought a lot of challenges in coordinating and the clarity of the roles between the national and the county levels. We have a national government, so politics influence and the bureaucracy delaying the further complicating the situation. You see, in politics, there are no nurses there. In bureaucracy or policy making, there are no nurses involved. So most of the time when healthcare workers are called for this, they are either doctors, mostly doctors. I may say other candidates are not found there. Career development, we have limited opportunities for career advancement and professional development as discouraged nurses from staying in the profession. There is also a need for better mentorship and leadership programs. All those are not there. So many nurses are being discouraged for this. So nursing capacity, as at 2022, these are the data I got as of 2022. We have approximately 1,030,959 nurses in cadres, and this includes various categories such as graduate nurses, enrolled nurses, reflecting a progressive increase in the nursing workforce over recent years. Number has been progressively increasing because there is still training going on, and the ratio of nurse to patient has been about 1:1,000, around 1,000, 1225. And the WHO recommendation is that. So this has made the care become very poor to most of the hospitals. The disparities highlight in the need of more nurses has been adequately not good. So most are in large cities. Most nurses are in large cities, and the nurses like going to the large cities because that in the large cities there is a lot of private hospitals which are paying better than the public hospitals. So this is the number of nurses who have been trained in that category. The black one is the registered nurses, and the gray one is enrolled nurses. Enrolled nurses are the certificate nurses, registered are the diploma nurses, and blue is the nurses with bachelors of science. So impact of nursing, investing in pediatric surgical nursing in Kenya. This one, we have earned several things involved here, but I decided to look at it, looking at our development goals. So I decided to put at least a few to show you that when we invest in surgical nursing in Kenya, I was thinking that there would be poverty reduction, which would increase the household production through disease prevention and health promotion. And then there is pediatric increase nurses, good health and well-being, which would help in pediatric nurses accessing people in the inner cities and remote areas for those in difficulty access of health services. You find that those people who are living in our rural areas, they have to walk for 5 kilometers for a dispensary or health center. Quality of education to nurses can contribute to the provision of quality education as clinicians and clinical faculties and prospects of students. In decent work and economic growth, this provides quality care and means that the individual can help self-sustaining life that is in fact increasing their productivity. They will increase in economic growth of the country, that is Kenya, and society at large. So I was really looking at our achievement or the impact which can come to our country, looking at our SDGs. So partnership of the goals, they work together and make intersectoral partnership, achieving health education and economic growth. So nursing training in Kenya, the Nursing Council of Kenya has accredited 145 institutions for training, that is midwifery programs and public and private. So I was saying, I would say we have a council who regulates the registration of the Kenya Medical Training Colleges. And this is the Nursing Council. After you qualify, you are registered by them. And these are the schools they have at the moment. And the only courses which are available for pediatric is neonatal nursing and pediatric nursing. Other perioperative nursing course and the nephrology, critical care nursing, emergency care nursing, oncology nursing, all those are done at 100 level, although they work in pediatric wards. So they are put in pediatric specialization, but they train as adults. So the only courses is neonatal and pediatric nursing. So pediatric surgical needs in Kenya is, we have a problem in accessing the pediatric surgical care. That is now the time you realize that 5 walking kilometers in the rural areas has really brought a lot of problems, because some of the people living in rural areas are poor and are living very low standards. So they are not able to access for the surgical care. Human resource is not really provided there because people are working in the urban areas for locums, so that when they are working for the public, when they are free time, they're in the private sector. So there are no specialized equipment in most of the public hospitals. Surgical supplies are poor. So you find so many people suffering. Thank you.
Thank you so much for that presentation. Quite thought-provoking, I must say. Thought-provoking, I must say, because again, this just continue to stimulate my mind. How do we get out of this hook? Nothing has come a long way. How do we get out of this hook? Thank you so much once again for your presentation. We are super proud of you. Thank you. And your national park, trust me, in the next few days, I'll be in Kenya. So get ready to host me. That is on the lighter note. Thank you so much. Distinguished colleagues, I would really, I'm serious. So you can stop sharing. So I want to sincerely appreciate those of us, still more than 30 people on the call with us. I want to sincerely appreciate Professor Emmanuel Anyembe, one of our critical leaders in nursing in Nigeria. And all the Nigerians on this call, we say thank you. And of course, our colleagues all over the world that have joined us, we say big thank you. But I really want us to, I know time has been fast spent, but just on the last note, because we've talked about so many things. Remember, the topic we're looking at is the economic power of nursing care, country perspective for healthy future. How can we have healthy future? How can we have how can we improve or boost the economic power of nursing care? But I want to say 3 things that stood up. Issue of leadership, issue of policy, and governance. Once we are unable to address those 3 issues, then we are still going to remain on the menu, eaten by others. And I just want just one point. I know, I pray Professor Marilyn is still on the line. Is probably going to, not probably, I really want her to just give us a comment. I know she would not like to say something on this, but we want to hear her voice. But before that, I want to call on Catherine from Philippines, because in all this discussion, it's only Philippines that has a better nursing package and involvement, and all we call inclusion. what will you say the way forward should be for us? Most of us, trust me, we have issues, a lot of issue, compensation, shortage, burnout, mental health. Not, in fact, that is another ballgame. But looking at leadership, policy involvement, and governance, in one statement, how do you think we can address this issue? Catherine, please.
Thank you very much, Bunmi. But that's a very nice question. So I think in the perspective of Filipinos, nurses are part of management committees and strategic initiative programs. We are given leadership roles, and we are prepared and being trained for these roles. That's why we are very active in the participation with regards to collaboration, as well as we are given the chance that our voices matters. We are being heard so much so that we can recommend policies, strategies, and ensure that our voices will be heard. So I think that's one of the very crucial strategies that Filipino nurses are now facing, and so I think that's one best practice that we can share to the whole world. Thank you, Bunmi.
Wow, amazing. So that means that we should try to be held, which means that the governors should give us opportunity to give us the chance to be held, to give us the chance to participate and contribute to the healthcare system, and not to use the structure to edge out nurses and the supporting system. On that note, distinguished colleagues and friends, thank you for joining once again. I remain Lawan Ayedun Olubumi from Global Initiative for Children's Surgery. Over to you, my chair, Professor Vinita.
Thank you, Bunmi, and thank you all the speakers for that wonderful session today. Thank you, Bunmi, for leading us and moderating this session and taking us through and giving a comprehensive conclusion. And thank you, each one of you, Professor Hyatt, Kay, Lydia, Amma, and Mrs. Evelyn is not here. To each one of you for taking time and preparing for this webinar and talking. Overall, I think we learned a lot about each other's country and what nursing is and how nurses are in each other's country, and every presentation had something to teach us. Thank you, Professor Hyatt, for actually telling us what exactly empower or the topic means, the title means. You gave a very good comprehensive definition of that, and all the others gave their country perspectives. One suggestion or one correction about the WHO ratio for nurses is 3:1,000. So every 1,000 population should have 3 nurses. That's what WHO recommends. And we are in our countries, we are all low and middle income countries. We are very far from that ratio yet. And what we see is our countries are in need, but at the same time, there's so much of immigration taking place. They're going out of the country, probably because of the need and the demand outside is more. There's opportunities more for nurses. The pay is better compared to our countries. So there's always this shift or migration that puts us at disadvantage in our country. So we cannot prevent anybody from going. We need to encourage people to be global. At the same time, we need to look at ways of making sure that we have enough number of nurses in our country. Thank you all, each one of you, for sharing your perspective, country's perspectives on nursing and nurses. We have just touched on pediatric nursing. I hope in the future seminars we'll concentrate more on the aspects of pediatric nursing and pediatric nursing care, especially surgical nursing care, so that we'll have more more knowledge on specifically on pediatric surgical nursing care. This was a wonderful background for who we are as nurses in our countries. So with this background, we'll be able to go forward with more of the topics, I believe. So once again, thank you. At this time, I also would like to especially thank Dr. Marlin for being here, supporting us, supporting our presentations, making sure that everything goes on well with the webinar. Thank you, Dr. Marlin, for being here, and thank you, each one of you. And I thank the participants for patiently listening to each one of us. And I hope it's been a wonderful session. I don't see any question and answer. I hope that means it's clearer and everybody understood what we said. Thank you for participating, all the participants. We are hoping to have more webinars in the future, but definitely we'll not have 1.5 hours of webinar. We'll make sure that it's of less time, so you will have precious time. Your precious time will be also thought of. Thank you once again. Thank you all. Good night, good evening,